Hello everyone, Dr. Abbas Naqvi here. In the next 15 minutes, I'll try to make one of the most efficient presentations giving a 360-degree view of the Canadian dental landing, planning the approach. This will seek to cover aspects related to NDEB, equivalency, immigration, coaching, your status in Canada, admissions, and a little bit about everything. So please fasten your seatbelts and let's try to go through this as quickly as possible. Please keep in mind, quickly does not mean not important. Quickly means each and every word and aspect of this 15-minute talk will be very important. You can pause, you can rewind, and you can even ask me later on what to delve into the details of anything that you did not completely understand. So with that, let's plan the approach towards your Canadian dental landing. The first thing that I would like to talk about is that after your basic dental education, you must always review your aptitude, whether or not continuing in dentistry or what path to continue in dentistry. What path is the most suitable for you to continue, whether post-graduation is for you or not, or whether you are open to diversifying within or outside of dentistry. This is very important. Once you're done with your basic dental education, or even if you are in the initial phases of your career, you have 4 dimensions that you need to be looking at, whether you want to move forward in the clinical area, in the academic space, in the non-clinical dental area, which is diversifying within dentistry, or any combination of the two. Obviously, in the clinical scenario, you could be associating at an office, or you could initially associate and eventually buy the practice or become an owner. Becoming an owner means you could be building a practice from scratch, or you could buy a running practice, or any combination of the two. When it comes to the academic space, you might have an aptitude for research, or you might want to go into specialization, which could lead you to a teaching career or a specialist practice career. Some of us are able to diversify them within dentistry and get into non-clinical roles which relate to business or management, and even to the extent of going into a non-dental role, which could be pharmaceutical or any other business. Or lastly, for those who are more adventurous, you can have a combination of any of the above. With regards to Canada, I'd like to address what is seen as the curse of context, because you need to understand the environment. As long as you're outside of Canada, you don't know a lot about Canada, and whatever you know, you don't know the right context, the environment of that situation, and which leads to migraines. So trying to avoid that, I'll give you a brief characterization of countries. Whenever you talk about a new country, you talk about the size, the physical size, the size of the population, and the size of the economy. From a Canadian perspective, Canada is the second largest country of the world. However, it has some of the smallest populations, which is only 36 million, usually comparable to the larger populous cities in South Asia. So while the physical size of the country is huge, the size of population is very small, and it's a small population spread over a large surface area. Economically speaking, Canada, despite its smaller population, is amongst the top 10 economies of the world, which makes it a very good reason for people to be inclined towards migrating to Canada. As far as Canadian dentistry is concerned, a little bit about the numbers, structure, function, and dynamics of it. Dental workforce is approximately a family of 100,000 people, 25% approximately of whom are dentists, another 25 dental hygienists. There's a sizable chunk of dental assistants and allied professionals that work in the industry, the miscellaneous roles that surround the dentist make up for 20%. We get asked a lot, what is it that can we do other than being a dentist? So here's a list of what happens in dentistry outside of being a dentist. There's hygienists, there's assistants, there is treatment coordinators, office administrators, office managers, denturists, dental technicians, dental sales and marketing, public health professionals, and consultants, coaches, or mentors. So as you can see from this list, there is a lot going on within dentistry, And those of you who want to, in the short, medium, or long term, look at other options other than clinical dentistry, there's a long list of, there's a healthy list of options to choose from while staying within dentistry. The profession in Canada, just a bird's eye view, it's a $14 billion industry, largely privately funded, about 90%. And within this 90%, the large chunk is insurance-based. There's about 14,000 practices in Canada, and the per patient value is approximately $380. This is a strictly regulated profession with just 15% of Canada's population having a compromised access to care. When it comes to the average starting salary, it's really good. It's about 100 to 130K per year. And you will see it in later on in this presentation that this is pretty decent and enough to cover the costs of your equivalency process. So whatever you've invested, you will recover in a very short time. But this also depends on many variables, which include the type of clinic that you work at, the type of patients that you see, the number of days you're working at the practice, and the number of hours per day that you are working. Now, a very important, in fact, the central idea of this presentation is approaching the process with regards to status and integration. Please keep in mind, I tell this repeatedly to all the people that I talk to, that treat the status part of the process and the professional integration part separately. Yes, you are the same person who is going through both of them, but as processes, they are completely separate and unrelated processes. When we talk about approaching the process, which is approaching your landing, on your left, you will see the residential status. On your right, you will see professional integration. There are 4 ways you can come to Canada: through immigration, work permit, student, and visitor. The least practical being the work permit. It's very difficult to get a direct work permit to come to Canada. But immigration, student and immigration is the most common. Yes, you can also come as a visitor and have your status converted later on. So let's talk about the process on the left first. Obviously, the eventuality when it comes to status is PR, and which leads to citizenship. With immigration, you can get PR immediately. You do get PR immediately, but that is subject to your points and your qualification. There's many people who come to Canada who find it easier to come to Canada as students. As students, your next step would be a work permit, which is the WP. And subsequently, the work permit will lead you to PR and citizenship. However, if you are able to secure a visitor visa, you could also consider coming as a visitor, getting admission, changing your status from a visitor to a student, later on converting to a work permit, and eventually moving to the PR. On the professional integration side, you have 2 main options, which is focusing on going towards clinical practice or into an allied career. Now, this allied career, as you can see in the flowchart here, this could be a temporary allied career that you resort to while on your way to clinical practice, or this could also eventually become your permanent allied career. And this means anything other than clinical dentistry. With clinical practice, you have 2 options. One is to pursue exams. The other is to go through schooling, which also begins with exams, but just to separate the 2 paths. On your left, you see the equivalency process, which leads to the general dental license. And next to it is the specialist exams. Having been involved in this space for about 8 years, I can confidently say that the equivalency process is the most predictable and stable option for whether a general dentist or even a specialist. So for some time, it is good to forget that you're a specialist, go through the equivalency process, get your license, and then you can still limit your practice to your area of interest. The DISCI and the specialist training is not a very predictable path. Opportunities are very few and far between. So therefore, regardless of whether you're a specialist or not, on this path, it's recommended that you take the exams and the equivalency path. On the other side, you see schooling, which means that after the AFK, you seek admission into an advanced placement program, which could range from 2 to 3 years. And this would also eventually lead you to a general license or just similar to the exam pathway. If you're a specialist, you could choose to limit your practice to just the specialty of your interest. If you choose to go the master's PhD specialization pathway, you will end up somewhere in the industry or in the academia in a teaching role or in a research or quite possibly even in a clinical specialization practice capacity. The allied dental space, I have created a separate slide for it. As you can see on the left, you can pause this slide and give it a reading. On your left are the roles that you can see: dental assistant, hygienist, restorative hygienist, office admin management, denturism, and so on and so forth. Then you will look at the education that you would generally require, community/PCC. PCC means private career college, private career college. So these are the places that offer courses. You can choose to take the course that will help you do your job more efficiently. Some of these areas are regulated, which means you need to be certified, you need to be licensed to be able to do that kind of work, and some are not. So please take a good look at this and feel free to ask if you have any questions. These are general points. If you have any questions, feel free to ask. Yes, and if you choose to take any of these allied dental opportunities or options on your way to a DDS, each of it will definitely add weight, but you do not require. You don't have to go through any of this if you're aiming for a university admission. With that said, if you are applying for university of admission and you have university admission and you have a background of any one of these roles, it will definitely be an asset. When it comes to effective time planning, what is the usual sequence that people offer? What is the usual sequence that people opt for? Is that they apply for visa. Once they get that, they travel to Canada, then they open their NDP profile, enroll for the exam, study, and write their AFK and ACJ. However, if you are not yet in Canada, or you have done a soft landing and gone back, what you might want to do is, once your status issue is addressed, you create your profile, you get the paperwork started. It usually takes about a year these days to complete this paperwork. In this meantime, you can start studying so that once your paperwork is approved, you can immediately enroll for the exam and travel to Canada, write the exam. And if you can get the AFK and ACJ out of the way in quick succession, trust me, your perspective of this process will change completely, and you may not have to look towards pursuing any allied career or temporary employment on your way to equivalency, especially with the added benefit of CIBC financial aid now being available. A short and quick comparison between equivalency and advanced placement. Equivalency is valid only in Canada, whereas advanced placement, which leads to a DDS, is internationally recognized. The overall cost of equivalency can be lower, just $13,000 to $50,000, $13,000 being just the exam cost and a one-time exam cost, and up to $50,000 being including the cost of preparation and maybe a couple of exams you might need to take them a couple of times, so that includes that cost. But as you can see from this amount, if you connect it to the average starting salary, it is very quickly recoverable, as opposed to the high overall cost of advanced placement, which could be anything north of $250,000. However, as you see, the availability of funds is slightly different in case of equivalency. Previously, the upfront availability of this amount used to be slightly difficult, but now with the CIBC program, that support is available. And in case of university, also that this amount, although it's large, its availability is not as difficult. Equivalency, some people may complete it in 9 to 18 months. Yes, that is doable. But in advanced placement, you really don't have a choice. You have to sit through the 2.5 to 3 years, and you cannot finish it sooner. Equivalency process, some people might never complete it, although the completion percentage is approximately 65%, and I'll tell you later how I get to that number. But once you are in a university program, completion is almost guaranteed. However, with that said, in the equivalency process, the window of opportunity is much wider. Approximately 300 people complete this process every year, whereas only 80 to 90 people get accepted into university advanced placement every year. When it comes to the cost, this chart kind of really separates everything out, dissects everything really nicely. You can see how much anything and everything can cost you. You can pause the slide and take a good look at it and feel free to ask if you have any questions. But you can see that the total cost could be somewhere between 15 to 50K for equivalency process, and it could be north of 250K, and take this amount of time, 1 to 3 years for equivalency and 3 to 5 years for the university program. These are ballparks, these are approximate numbers. The actual numbers may vary. How it works. This is a very important slide, and I think no one else will dissect this for you like the way I've done here. Although the pass rates for AFK, ACJ, ACS are about 45, 40, and 35% respectively, those do not reflect the probability of your success. Please, I say this again, do not interpret this pass percentage as the probability of your success. What is the probability of your success? Please look at the chart on the right-hand side. If 100 people, and this is reasonably accurate because the numbers that have been used here have come from the technical reports released by the NDAB. So if 100 people were to start the AFK, they are able to take that exam 3 times, and considering the pass percentage of about 45%, what will happen eventually after the first attempt where this number of people pass, and I've, in the first 2 attempts, I've used the word did not pass or do not pass. I've not used the word fail, because I don't consider this as failure. At the end of the day, about 89 to 90%, have you ever thought about this? About 89 to 90% of people are likely to pass the AFK. Let that sink in. If you continue this process similarly, the same 89 people who end up here, they go through the ACJ and then ACS, you will realize it's surprising that 65% of people will eventually complete the equivalency process. If they stay put, if they are confident, if they're consistent, if they're persistent, 65% will complete the equivalency process. That's something. Now, obviously, aside, we can offer you help with the didactic and clinical programs both, and feel free to ask us if you need any help with AFK, ACJ, or bench test and ACS preparation. We're happy to help. This presentation is more about having you understand and give you some perspective on the process in its nuances and its context and the larger picture. Not to give micro details, but I did give a few micro details and some important micro details that you will find beneficial. Again, this was a quick review, but doesn't mean that anything was less important. In fact, I've summarized everything that is the most important in about just 15 minutes. I'm not sure if I've reached that limit, but I hope this was beneficial for you and this was a good use of your time. Thank you. Goodbye. Take good care of yourself.